Now with the lumbar spine, because of the approach coming in through the abdominal cavity, there are some very different risks than the cervical spine. The access or general surgeon who works with us is there to help minimize those risks. We have to move the intra-abdominal and the intrapelvic organs out of the way so that we can get to the front of the spine. So some of the structures that can be injured, though it's very low likelihood, are the things like your bowel, your bladder, the ureters, which are the tubes that run from your kidneys to your bladder. And then one of the things that we worry the most about as far as risk potential is the big vessels. The aorta and the vena cava, that's the vascular supply from which our body receives blood flow. And those are things that have to be moved out of the way. So these are, again, access-related structures that can be injured, but given the low risk of any of these structures being injured, I would tell you it's something that is unlikely, and if something happens, these are all structures that can be addressed and with the help of our access surgeon, generally treated at the time of the surgery.